prior to psychiatry, I had done a year of general surgery. Surgery is, from my experience, something more like visiting a national park. So you might go to Yosemite or Zion, and when you get there, there's signs everywhere. You can tell where you are, and then you get on these trails. They have clearly laid out signposts, and you're hiking sometimes for 2 hours, sometimes for 8 hours. And it's a long process. A lot of the work that you get is not in figuring out exactly where to go per se. Most of it is pretty well laid out in front of you. You get credit for being able to kind of go further than the next person or be able to take on the whole hike. But if you're the kind of person who's willing to take all those steps, then you get to the end of that and it's a beautiful view. It's well worth the effort. Psychiatry is not really like that. Psychiatry is a lot more like kind of wading into a forest. It's sort of like backpacking or backcountry camping, where you got your backpack, you have some experience because you've been on different hikes before, you kind of know a little bit of what you should look for, but you don't exactly know what you're going to get when you're in there. And then when you get into the forest, and then you sort of start to look around, and it relies a little bit more on some balance of intuition and experience, and there's trade-offs with both of those. And so I find that if you're more interested in backcountry camping, you're probably more inclined to a field like psychiatry, and if you're more interested in hiking at a national park and these long adventures up a mountain, then probably surgery is more your interest.